All of us and all our staff want to give good care. We're in a customer care environment, and it's really important that we can quickly assess the levels of care we're giving.
Frequent feedback is a mechanism that we use to gather real-time patient experience data. The Picker Institute have got lots of expertise in developing patient experience questionnaires. We use our volunteers to meet with patients, to ask them questions about how satisfied they are with their care and treatment in the organisation. They collect feedback through the use of PDA devices.
It's a bit like a BlackBerry. It's touchscreen and the questions come up. I'm Rebecca, I'm a volunteer, and I was just wondering if I could ask you some questions for a patient survey.
Because it's a volunteer, they're going to be an impartial person and they can be totally honest with them.
When the patient gives their response, it automatically goes into a database and it's analysed, and that's where Picker come into their own. They have experts who look at the data, look at trends for us and produce a report for us every month. And Picker have been very responsive to help us to present the data in the way that we need to for the various different reports.
The major priority is to make sure that the ward staff get the feedback, but we use it organisationally as well. It gets shared at core briefs so that wider groups of staff are aware of what the key themes from patient feedback are.
You can see areas where you do need to improve, and you can put things into action to improve that experience for the patients.
Some of them seem very simple. Some of our patients were finding it difficult to sleep because of noise at night.
As a result of that, we've put in quiet closing bins, so bins don't bang at night. So whereas normally you put your foot on the bin and you walk away and the lid would crash down, these bins actually close quietly, and the patients have given us positive feedback.
These signs have been implemented as a direct result of patient feedback to improve privacy and dignity in our ward areas. They're a simple visual clue that can be clipped to the curtains to alert the healthcare staff, to speak to the patients, to make sure that it's appropriate to go and enter through.
We can see almost immediately whether any improvements that we've made are making a difference to patient experience.
The main benefit of the PDA methodology is the flexibility. Not just flexible in use, but flexible in what questions we ask. So if we find we've got areas where we ourselves are worried about services, we can actually work with Picker on developing some questions and actually go in and actually target patients within those areas.
It's really positive for the teams to see that we are improving in an area of care.
A lot of research shows if you've got staff who have been acknowledged that they continue to give good care. And I think that has helped staff morale.
I've been in hospital before and there were flaws, but I have to say my experience of today, it's vastly improved, and that's due to patients having the opportunity to feedback on what is going on.
Over the next few years, what I want to do is expand the numbers of patients that can actually give us that feedback.
We're working with Picker to develop new systems.
We also want to look at how we can adapt the use for some of our more vulnerable patients, our patients with learning disability perhaps, and already our paediatric teams are looking at the types of questions we could ask children.
What I get out of volunteering is the satisfaction that you will improve the care of the patients whilst they're in hospital. Patients do feel involved in their care whilst they're here, and that their views are appreciated and probably noted.
It is a very valuable way of gauging the patient's feedback.
It puts me at ease, and I'm very pleased to see the hospital was doing something of that nature.
I really do think we've got a product that really does meet our needs. In Southampton, it's here to stay.